served at every level of leadership within the NDA. He has testified and presented on Capitol Hill numerous times and is a subject matter expert for federal agencies when it comes to oral health. Dr. Fletcher, is also former poll marker of the Baltimore Alumni chapter and past president of the Kappa Alpha Psi Foundation of Metropolitan Baltimore. He graduated from the Howard University College of Dentistry in 1987, graduating 10th in his class. Our other panelist is Dr. Johnny Rice, who is the chair of the Social and Political Action Committee for the Baltimore Alumni chapter. He's an assistant professor in the Department of Criminal Justice and Law Enforcement at Kappa State University, College of Behavioral and Social Sciences. He has spent 21 years providing leadership, technical assistance, and support to organizations that serve low-income fathers and families in the areas of child welfare, youth development, and criminal justice. He attained his BS and MS degrees in criminal justice from the University of Baltimore and his Doctor of Public Health degree from Morgan State University's School of Community Health and Policy. So, gentlemen, given the facts that I set out just a few moments ago, why should we care? Why should the community care? Why should African Americans care about COVID-19 and all the ramifications, social distancing and things like that? Dr. Drummond, can we jump to you?
Yes, I think it's a great question, and I'll try to be brief in my response, but there's no brief answer to it. We should care for a number of reasons. What we see is that not only is COVID-19 affecting the African American population directly in a larger than expected capacity, we see it happening in regards to deaths as well, which is the more troubling aspect of things. Us in the medical community have been basically trying to figure out why that is. And I think the answer is that it's multifactorial. But a large part of this, yes, it's due to maybe some underlying health conditions that we may have disproportionately, but it's bigger than that. And it also has to do with the fact that, a lot of minorities, and specifically African Americans, are frontline workers and they can't stay at home. And so they aren't able to practice some of these social distancing techniques. In addition to that, they have to take, public transportation, which is also places them at increased risk. They don't have the access to medical care facilities as much as other individuals in the population. But one of the things that I try to stress to a lot of my patients in terms of why they should care is on a very personal basis, right? So there's the larger picture of why we should care just in terms of its effect on society and why we should be social distancing and how it's affecting the healthcare system and how we don't want that to be overrun. But on a more personal level, we need to make sure that everyone understands that even if you may feel fine, even if you may not have any symptoms, even if you say, "Doc, I never get sick, I don't get the flu, I've never been to the hospital," that may mean that your immune system is stronger. And what we're seeing from this virus is that it will very, very likely jump from you into someone who is weaker, and you can affect a family member in a very, very critical way. So I would say that's my answer to why we should care on both a large scale, but even on an individual level, and why we really should heed to the recommendations that are being put forth by various community organizations, CDC, the task force, et cetera.
How about you, Dr. Fletcher? What are your thoughts? Why should we care?
Well, one of the first things that I would say to piggyback on Dr. Drummond is not only on the individual basis, but also certainly on the community level. Oftentimes we see when we have medication, there's side effects. and you'll see that 1 out of 100 side effects can arise. But if you happen to be that one person that side effect occurred on, it's 100% for you. But that other 99 could be affected in the community, as Dr. Drummond said. It not only affects the individuals, but it affects the families, and it affects all of the people that you happen to potentially come into contact with. If you happen to be an individual who works in a large clustered office with low-lying petitions that easily you can stand above and speak to the person next to you, that's a person that you know directly, and that person could be infected, could infect you, could infect everyone within a good 10 feet radius, everybody who passes by, and whoever they come into contact. And so if one person is infected and they touch 6, and those 6 touch 6, and those 6 touch 6 more, you see the numbers begin to escalate very quickly in the community. That from the standpoint of the effects on business, if you happen to be in an office and that affects that business and everybody is out, the business doesn't get done. If you go to the grocery store, and those individuals who interact on a daily and hourly basis with patrons coming and going, if you infect one of them and he affects or she infects the others, and nobody can come to work, the shelves don't get stocked, the food doesn't get placed out, everybody is looking for their next source. So we should always care, because we in fact are our brother's keeper. And we do need to consider the thoughts and the effects on others when a situation like this comes about. The effects internationally, just it speaks to the exponential factors that come into play. And it also affects the policies that tries to address that from a public health standpoint. And everybody does not necessarily understand why the policies are in place to stay at home or to wear a mask. But there are times when you have to listen to the experts. None of us knows everything, but for those who know in specific areas, we should take heed.
Thank you, Dr. Fletcher. Now, Dr. Rice, you hail from a different discipline. From your perspective, why should African Americans care?
Well, thank you, Brother Wood, and I appreciate the opportunity to really be a part of such a meaningful conversation. I think that it's clear that COVID has affected us, and as Dr. Fletcher stated, globally, but as well as locally in unique ways. I know for me, I care because a lot of my work, and I'm sure individuals who are on this live stream and participating have committed their life to healthy and safe homes, healthy and safe schools, healthy and safe workplaces, as well as healthy and safe communities. But what has been interesting, alarming, has been that COVID has changed the way that we relate to one another, not just on an individual level, but how we interact with our community, how we interact with institutions. I'll give an example. Culturally, one of the things that we have observed is the unfortunate premature deaths of members of our respective community. And there's trauma associated with that death. But what has been very different, particularly for the African American community, is having the death of a loved one and being unable to fully celebrate that life in a way that mirrors our culture and our village. Another example that I would state that has shown how this has impacted our life is just in terms of work and school. And I've experienced students who have worked hard, who've looked forward to the culmination of graduation. It's not just me, it's across all levels of education. And you have students who are confused and not understanding why they're unable to really go through those classic rituals of celebration. So these are things that, while they may seem small in the larger context of physical health, they do have an impact on mental health. And another thing that I think is very important is, and why this is important, is dealing with the fear that's associated with COVID-19. So for many of us, the normality of our lives has really been tested and has changed in ways that we could have never imagined. And I believe Brother Fletcher had also spoke to this in terms of simple things such as going to the grocery store are a process now. And then there's even fear and risk involved with that. You know, questions are being generated by society, by our families, by our friends every day. Those questions are, how will I have my basic needs met? You know, how do I support my children during such a challenging time, even when I'm not sure where things are going? And I think also we have individuals who may have elderly parents and are concerned about infecting them or their quality of care, particularly if they're in a nursing home. I just want to read this very briefly. This is a survey that was recently done by the American Psychiatric Association, and they highlighted fear factors. And these are some of the results on how COVID-19 is affecting Americans. 68% fear lasting impact on the economy. 59% fear the coronavirus is having a serious impact on their daily lives. 57% fear a negative impact on their finances. 49% fear running out of food, medicine, and supplies. And 36% fear that the coronavirus is having a serious impact on their mental health. And I'll say, lastly, Brother Wood, that as a criminal justice, social justice faculty member, and that being a space that I'm interested in, I am concerned about, and this matters to me, what's happening to our marginalized youth that were already on the edge. And now that services by youth development and youth serving agencies has shifted, will some of those young people fall through the cracks? What's going to happen with our returning citizens who are transitioning out? Are they getting the services that they need, even though they're being released early? And how are we taking care of our staff, as well as those offenders who are still housed in correctional facilities? And domestic violence. We know that as families come together, as people are forced to self-isolate and spend more time under one roof, the issue of domestic violence can be enhanced and there can be a higher incidence and prevalence. So these are reasons for me as a community member, as being a part of our collective village, as an African-American male, as an African-American member of my community and society, why I care.
Thank you, Dr. Rice. Let me ask you all this. Given, well, you know, the first step in trying to fight the coronavirus is to do what the experts tell us, to take care of ourselves, protect our loved ones, you know, social distancing, quarantine, things like that. Can each of you tell me what, based on your observations and your personal, professional, and academic training, as well as the unique lens that you bring to this, what are we as a community, African-American community, getting right in terms of addressing this pandemic? What areas do we need to get better, to prioritize? And you know, as we get conflicting information from the White House about opening up our economies, you know, how should we move forward given the current situation and what we expect to happen in the near future with the virus? Anyone want to jump in? Dr. Drummond, want to come back to you?
Yes. So
what are we getting right?
Exactly. What are we getting right? Yeah. I think that for the most part, after an initial initial nudge, I think we're getting right in terms of following some of these stay-at-home orders. I think we're getting right the social distancing for the most part, right? Things that we need to work on. I think that there are issues in regards to, as you mentioned, who do I believe? Like, who do you believe? There's so much misinformation out there. I find that I'm hearing a lot of individuals tell me, Doc, I don't know who I should be listening to. Should I listen to the president? Should I listen to my mayor? Should I listen to my governor? All of which may be saying different things. And to that, I say, if someone decides that they want to go out, they want to go shopping, they want to do these things, the best advice I can give in terms of how to do that is make a couple of assumptions. Assume everyone around them has COVID-19. Assume that they themselves has COVID-19. If you start with those two assumptions, then you'll make sure that you're wearing a mask to try to prevent transmission to someone else. Be mindful of touching your face. Be mindful of touching public areas and not having hand sanitizer, et cetera. I think those are the things that we can do better at as we start to transition back into society, regardless of who's telling us what to do, what not to do, go out, don't go out, go to this place, not that place. Start with those two assumptions. A, everyone around me has it, and then B, I have it myself. And I think that will go a long way, regardless of what part of the country that we're in and how soon we get reintroduced to society.
Thank you, Dr. Jones. Dr. Fletcher, any thoughts?
Well, to give the counter to what we're doing right, I think that there are times when the thought of invincibility comes into play. And someone will say, that won't happen to me, until it does. And when you have that attitude, the factor of you infecting others and others infecting you doesn't have any effect on your behavior. And the consequences of that can be death. So I think that when we look at the statistics on the age, and again, the myths of, at one point, African Americans thought that they couldn't get it. They thought that children were immune, that only older people and people who were medically compromised. Well, this affects everyone. They're finding new syndromes. They're finding that the effects of this on those who may be symptomatic and those who are asymptomatic are manifesting themselves differently with different individuals. And so there's so much out there that we don't know, that is to err, to be cautious, is the prudent move by the wise man or wise woman, to err on the safe side first and be, remove that invincibility thought process, because simply because we think it could not happen to us, you can step off the curb and get hit by a car. But if you're safe and stay on the sidewalk, the likelihood of that happening is diminished. So if you do wear the mask, do the social distancing, follow the rules, and to the question of who should you listen to, you should listen to an expert. You should listen to the person who has studied it, or who is medically trained, or someone who is in the field. You don't want to listen to an individual who is getting bad advice and conveying that bad advice. So I think that if we recognize that the consequences of our actions can affect others, and that we remove ourselves from the invincibility syndrome, I think that the community can be safer, that we can approach things in the proper manner until we really understand better what's going on, because this virus, I had never heard, seems to be a smart virus. It seems to find the people who have the maladies to make it worse. And it's finding other ways to attack individuals, the lack of taste, the lack of smell. These are things that we haven't heard before. And so anytime, I'm a risk averse person. I'll tell you, I'm not a bungee jumper. I'm not jumping out no planes. You know, I'm not a skier. I might hit a tree. You know, so I'm a little risk averse to begin with. But then you put on top of that, I got some medical training. So I would just suggest to people that you listen to experts, stay safe, listen to the recommendations until we have a better understanding before you venture out.
And how about you, Dr. Rice? You may not be coming from a medical point of view, but from a social interaction point of view, what are we doing right? What are we, or what do we need to work on as far as African Americans are concerned?
Thank you, Brother Wood. One of the things that I thought was great in terms of intentionality and response was for policymakers, community activists, as well as legislators, pushing the needle in terms of the collection of data and being able to make that data available in public, and capturing relevant data that can be used for public health research and analysis is very important because it gives us the opportunity, one, to evaluate trends in real time, but in some instances, it may help to be able to forecast and project different aspects of COVID and its impact in a range of areas. I think also in looking at the data that's collected and looking at socio-demographic data, we can get an understanding of who's most impacted. And I know that that'll be a part of our discussion. And you, Brother Wood, you set the stage when you gave some of those factoids earlier. But allocation and mobilization of resources are informed by looking at the information that's received. And so I think the efforts to collect information and data are really vital. And what I've appreciated is not only the data trends that we see every day that kind of gives us a wide lens perspective and view of the impact of COVID in terms of new cases and fatalities, but it also helps us to connect and get an understanding when we see those individual stories. So when we hear about an individual who lost a mother and a brother within a week, we can be empathetic and come around as a healing community to support that individual and their family. But we also understand the broader impact by looking at these statistics and data that shows us how our community more specifically is being impacted. I know for me, I bring a humanistic framework to everything that I do. And so when you look at those numbers, while it's good that we get that information, it also masks a lot of sadness and pain. And so I think that the good thing is that there is a focus on collecting that information and data so that we can have accurate understanding of the impact of the problem, what groups are most affected. But I also think that in terms of what we can do better, and this was mentioned earlier, how do we filter the information that's provided? So once we know what we know, how do we take that information and use it for informed decision-making and not have it be something that's used by internet trolls to try to shame or make a group feel bad because they're most affected. And so I think that better ways to filter information and being able to connect people to verifiable, legitimate sources of data is important. And also the data helps to amplify the issue and gives us an idea where we need to really target and spend a lot of focus on. Now, I know that this affects everyone, but those individuals who are disenfranchised, underserved, already impacted adversely by poverty, we know that those individuals are going to be suffering as well. And so we need to make sure that we create spaces that they get the information in a meaningful way also.
That actually brings up a good point, Dr. Rice. What can we do, panelists, to protect ourselves, our families, and then also to help protect and defend the interests of our African American brothers and sisters who might be homeless, might be stuck in poverty, and not have access to as many resources. What can we do to like what resources can we access by ourselves, and also maybe make sure the family members have access to, and then what can we do also to help the larger African American community? Dr. Drummond.
In regards to what we can do to help the on a larger scale to help the African American community, some of these things we've already touched on, but to kind of reiterate, information is going to be key, but information coming from the right sources. So those of us that have that information, it's really is the onus is on us to make sure that we're giving that information out. Myself, Dr. Fletcher, I know a number of us have been doing that on a number of forums, as many forums as we can. Right now, social media is the most popular way to do that. And so I think there really is, this is the time to not sit at home in the safety and comfort of our house. This is our time to basically use what we've been given, use those tools, use that education to really inform everyone, because information coming from us is just going to be taken differently than information coming from, number 45 or someone else that individual in society just may not feel comfortable with. And I'll just speak on here in Los Angeles, they started a clinical trial where they're testing antibody tests. And they asked for individuals to come forth to do some antibody testing. And they did a whole article on the fact that many African Americans just don't feel comfortable. One of the ladies that was interviewed said she immediately got flashbacks of Tuskegee experiment, which went on for, I don't know if many people know, for over 4 decades, right? So we have to make sure that we do our part, I think, in terms of using our education, using our knowledge, using what tools we have personally to make sure we're giving that to our community.
Brother Fletcher, Dr. Fletcher.
So again, giving the counter to that is that we have to dispel the myths, because we do have the information, we do have the knowledge, we do have the training, that when you start to hear the conspiracy theories and individuals who may not have the same level of knowledge begin to promote certain thoughts, certain conspiracies, certain theories, certain philosophies, that you have to, in the interest of the community, dispel the myths. Because if, just as any rumor is spread, it spreads quicker than anything that you can imagine. And the truth somehow is the turtle in the race, while the myth is the rabbit. And so it's upon us who have that knowledge to make sure that the proper information is there, and that even from the standpoint of a scientific basis or some other basis of fact, that you dispel the myth. Mm-hmm. Not just simply say that's not true, but to appeal to the logic of the layman and spell it out as to why it doesn't make sense. Give one example is the 5G conspiracy thought, that somehow 5G that's used on cell phones is strengthening this virus. It has some effect on this virus, but when we consider that 5G is in the air, why didn't it affect us before the virus came along?
Right.
It doesn't make good common sense that a virus would be affected, and we as individuals carrying a phone, receiving 5G in the midst of 5G at all times, that we would not be affected as well. So it's upon those of us who do know better to do better, and to inform those who may not have that knowledge, to make sure that the community does not get caught up in the myths and go down the wrong path, which certainly can have devastating results.
Well, since you brought it up, Dr. Fletcher, please jump in, panelists. What are some of those myths that we heard? I mean, when we first heard about coronavirus, we thought that no Blacks could get it because Africa hadn't shown any cases, and it was mostly Europe that was being hard hit at the time. So, what are some of the myths? Let's separate fact from myth.
Well, another one that I had heard was that the virus had been weaponized in China. They've done for those who don't know, there's the opportunity to map out DNA, which is the core of every cell, including in a virus. And from the standpoint that they can map it, they can see if it is a mutation or some slight change from another virus, or if there was something specifically placed and snipped into that DNA. And they can understand that they can trace it. They can see that there are different strains of a virus based upon its DNA. And so the myth that it was weaponized in China is not true. They know that it is a slight mutation from another virus because there are several coronaviruses out there. This is one that happened to be this particular assembly of DNA that's causing this particular issue. So the difference is that somehow it's propagandized to incite those, and those who then perpetuate by using the term China virus, when in fact the one that came to New York came from Europe. And that was one of the first that was found. It didn't come from China. So that's one myth that's out there. And of course, you mentioned the one about African Americans, and much of this is about the social setting.
Listen to, or you doing something? I wanted you to listen and tell me what you thought about that discussion.
Please, everyone who's watching, please mute your screens. Thank you.
So you have social conditions. You'll notice that Italy, when you look at the movies, those streets are narrow. People shop at an open market. They live in apartments. They're in close proximity all the time. They're a very social culture. So that's why it blew up there, and that's why they locked everybody up to keep them in touch with each other.
Let me tell you.
And it was successful. So, they're talking about the rural aspects now, and that it's not affecting the rural populations. Well, in fact, it's coming to Iowa. It's come to Wisconsin with the meat packing, which are very rural cities. They're small towns, small cities, but it's hitting there. It's just taking time. Most of this has to do with travel. When you say that there was nothing going on in Africa, for the most part, the traveling is being done by those in Europe and China and others in those areas, and very much from the United States as tourists. Many of the countries in Africa are not in a position to have full-scale travel for tourism when you have dirt roads and you're getting water from wells, or you have to travel 2 miles to get water. So much of this is culture, and much of it is the travel. So we have to keep those things in mind and make sure that we check our sources before we take something that you heard for the first time and now you're running with it. And please, please do not post it on social media. People are looking there, and we all know the joke that everything on the internet is true. We know that that's a myth in itself. So those are some of the things that at least I'm aware of.
Dr. Rice, Dr. Drummond, you want to jump in?
Yeah, I was just going to say that a couple of weeks ago, maybe 2 or 3 weeks ago, I read an article about a family, and a stepfather told his son that he did not want him to go out because of the threat of the coronavirus. And the son was a younger man, and he disregarded his father, and he left out of the house. And his father was very angry about that, and I believe he locked his son out. His son kicked in the door. They had an altercation, and unfortunately, the father shot and killed his son. And so I say that to say that one of the myths that I see that I think people are working more to address is the issue around how do we effectively communicate to young people the risk of their association or going out of the house and hanging out, because again, we know that younger people, they are still developing in terms of the mind, in terms of their interests, and we know that to them this is very difficult and challenging, because this is a time where they should be out and doing those cultural enrichment, school academic, athletic activities that they love to do. But we clearly see that it can have an impact on not only young adults, but now we're starting to find out and see that it's having an impact on even adolescents and infants in very negative and adverse ways. And so, and we keep learning more and more each day. So the effect of children, on children and young people is one of the myths in terms of, well, I'm young, I'm healthy as an ox, I'm not worried about anything. We see on social media a house party in Chicago with young people gathered together saying, hey, you know, we're not too much worried about this. So if, as the leaders in the village, how do we engage as elders in the village? How do we not talk down to, how do we not disrespect, but how do we develop a healthy engagement around these young people so that we can get them to understand the risk, but also at the same time, let them know that we love and care about them. Many of you all saw NBA player Rudy Gobert, and you know, he was laughing and touching people, and he eventually apologized when he came down with COVID, and unfortunately, he infected others. And so we know that young people can be impacted. They can die as a result of COVID, and they can spread it to others. And so I think that one of the things we still need to do is to continue to work and to build a dialogue between these different age groups, so that it's not that we're trying to restrict your freedom, but we have to convey that we care and still ensure that there's some accountability involved as well.
Have you heard any crazy myths out there, Dr. Drummond, out in LA?
Yeah, I'm going to go down just a quick list of them, just from a medical standpoint. Myth: you cannot cure the virus by breathing in a combination of hot pepper, hot water, and lemons. This is a very weird myth that's out there. Myth: you cannot, drinking a bunch of vitamin C is not going to cure the virus, okay? Myth: hydroxychloroquine has actually not been shown to be a cure for this virus. Right now, there is actually no cure. There are treatments that are effective. So fact is, there is one treatment that has been shown to be effective, and that may be pushed forth soon, but there are no cures. The body is what's curing the virus. I think Dr. Fletcher mentioned earlier in regards to this not being weaponized. That's a huge thing, because it feeds to the hysteria that somehow someone in China created this and released it out on the public, and that's just not something that has proven to be the case, as he mentioned very eloquently earlier. All the studies are showing this is just the 7th coronavirus that's been shown. There are 2 strains of it, 2 major strains, strain L and strain S, but this is not something that was created. Another big myth that I just wanted to make sure I touch on, that I think a number of people still believe, which is why a lot of people don't understand why the society is shut down. And there's the myth that look, we have other coronaviruses. This is just like the common cold. This is just like the flu. And that's one of the worst myths that's out there. And I've tried to really emphasize to folks, the biggest difference between this, the flu, even if we want to compare it to SARS-1 and MERS, is that for SARS and MERS, the reason they didn't create a pandemic is because their mortality rate was so high, it pretty much wiped out almost everyone. Also, within those individuals that got MERS, they knew it immediately. When you got SARS, you knew it immediately. It presented within a couple of days and you got really, really sick. This virus is very different compared to those two coronaviruses. It has been shown to have up to a 24-day incubation period. It can jump to asymptomatic people. It affects this person, doesn't affect this person. It's unlike anything we've ever seen. So it's not going to go away overnight. It's not going to just disappear. And the biggest thing, the big fact that I want to say is it's very likely that everything that we're seeing, this is following the pandemic of the early 1900s with the Spanish flu. And so we very well may see a second wave. It's likely going to happen this fall during the winter. And it may be 10 times worse than this. Those are just what the epidemiologists are saying in terms of this second wave. So I just want to make sure that we understand those. And the last thing that's a myth in terms of this being compared to the flu, if we didn't have Tamiflu and a flu vaccine, we very well may see a flu pandemic every year. Those are the two things that keep the flu from causing a pandemic. And so this virus is the first time that the entire world is seeing a new pathogen. And what we are seeing on an individual level and a global level is how each individual's person responds to this brand new pathogen, and it's different for everyone. And so those are the big facts, fiction that I want to make sure I just put out there, at least from a medical standpoint. This is not the flu and it's not a common cold. It's much worse than anything we've ever seen.
Well, let me ask you the million-dollar question. Something probably everybody on this call wants to know. Given, governors who seem like they're beginning to relax the restrictions and everything, but given what you just said about, the second wave coming, I mean, should we start going out to get a haircut, doing small things? Should we stay in like we have been, or wait till later in the summer before we venture out to see how hard hit the rest of the country is? Or, can you give us some advice on, given the information we have now, on, when can we go to the bar to meet with our friends? When can we get a haircut? Women get their nails done, things like that.
My personal advice would be that, and then again, I don't run the country. I don't make these policies. My personal advice would be that things don't open up again until we have wide-scale immediate testing. I mean, like within hours, being able to test the entire population, and then also and/or a vaccine. From my understanding, there are multiple groups around the world that are working on a vaccine. The father of one of our fraternity brothers is actually the head of the Vaccine Research Institute at the NIH, and they're very, very, very quickly working on something. There's an African-American female scientist who is actually leading the team that's working on the NIH effort for the vaccine. They're actually in clinical trials right now, but what people have to understand is that the vaccine have to go through multiple stages. You have to show safety, you have to show efficacy, you have to show this over a long period of time, no side effects. So when we say 12 to 18 months is like supersonic speed for a vaccine that's safe, that's what they mean. And so in my opinion, in regards to the question you just asked, I don't think society should resume being normal in terms of our normal activities, doing those things until we have both immediate testing and vaccine or some type of treatment similar to what we see in terms of Tamiflu.
We had a question from one of our viewers about, you said that the body cures the virus. Can you expound on that a little bit, of how our own defenses help fight off the virus?
Yes, that's a good question. And I actually mentioned this on one of my other posts. So there are actually some pathogens that will release a killer toxic protein, right? Like there's some pathogens that will release a protein that literally causes diarrhea, right? There's a toxic shock protein that's released from staph bacteria that actually it's called an exotoxin, right? So there are bacteria that do that. This virus is literally just trying to live. And so what's happening, what you are seeing is every single person that gets an infection, the body mounts an inflammatory response. And that inflammatory response, if we got some echo, that inflammatory response is what controls. If that inflammatory response goes awry and goes crazy,
Please, everyone, mute your microphones. Thank you.
if that inflammatory response goes crazy, then that basically you end up with this, what we call cytokine storm, okay? That's these interleukins and cytokines and chemokines. These are all things that are doing their job. They're trying to fight this pathogen off. The ones that do it in a very clear and precise fashion are the individuals that get a little bit of a sniffle, body does it, controls the virus, and it goes away. But for some individuals, they have a hyperactive immune system. It's like throwing a hand grenade at an ant. The body doesn't know what this is, and it's throwing everything that it can, and it all starts to spiral out of control. And that inflammation leads to, it's what it's leading to the organ failure, et cetera. So we call that, it's a very specific process that goes from the inflammatory response syndrome to sepsis, severe sepsis, septic shock, multiple organ dysfunction. And so that's what's happening. So there's no killer part of the virus that's going out and basically shooting up the organs. It just doesn't work that way. It's our body's response. So our body is actually going to either have a minimal response, it's going to basically see it and control it and get rid of it without a lot of side effects, or it's going to have a more moderate response or more robust response. And those are individuals that are ending up in the hospital, that are having the fibrosis, which is due to the inflammation, that are having those bad responses, some of them needing to be intubated. And then there are the individuals that they're just having their immune system goes crazy, goes out of control. We can't help control it. And those are the individuals that die. Now, the last part I want to say to this, not to belabor the point, but it's important because we still don't know what type of long-lasting immune response we're going to have to this virus. What we think is going to happen is the individuals that have a more robust response, that actually get really, really sick, that are in the hospital, they may end up with a longer course of immunity. It's just the way the body responds in terms of how the immune system develops. They may end up with a better and a longer immunity towards this virus. Some individuals that just saw it and it went away, they may or may not end up with a long immunity. So those are things that we just don't know. Historically, coronaviruses don't trigger the type of large, long-lasting immunity that we see in some other infections. So those are some key points that I wanted to make.
Well, how can we boost our immune systems, and what can we do to fight the inflammation that may occur and other responses?
You know, we're still, so from boosting the immune system, I think that, and I've shared this with a number of individuals, there are a number of natural things that you can take, okay? You know, we've talked about some of the things like zinc and turmeric and some of the other things that will help to boost your immune system, okay? And those are things that are, again, they're natural and they don't seem to have a lot of negative side effects. Now, we have to also think about what we've seen is that maybe there are some other anti-inflammatories that may cause an even worse condition in regards to the immune system. So when we think of anti-inflammatories, there's two types: steroidal and non-steroidal in general. When we think about things that have been marketed, a lot of these natural products, they have some anti-inflammatory properties as well. Vitamin C is it's going to help in terms of an antioxidant, right? So these are some of the things that you're likely going to be able to take large amounts of and won't have adverse side effects. I do like to just caution individuals to be very careful when they're taking some of these things that may not be FDA approved, because although they may work, and even though they're natural, they may work, they may have side effects that we just haven't figured out because they haven't gone through the FDA approval process. But I think that the same things that we've always done in terms of having a healthy and balanced diet are going to be important to helping immune system. But some of these other natural products like turmeric and zinc and things like that, I think are going to be helpful as well.
Johnny Rice, Dr. Rice.
Yeah, I just wanted to also follow up on that in terms of, you know, this aspect of mental health and wellness. And, you know, you hear people talk about, you know, mindfulness and things that you can do to try to help you be at peace and to be able to deal with some of the stressors that may present themselves. But hearing Dr. Drummond also had me thinking back to the issue around resources, right? Because, you know, even if we're talking about trying to have a better diet, you have to have, you know, the resources to be able to do that. And we know some of our residents, they live in areas that are food deserts. And now it's even more with limited transportation and services in the community because of COVID, it can compound stressors that they're already dealing with. And some of those stressors are stressors, again, that kind of cut across that social justice, criminal justice area. I just want to read something real quick, just to put in context how COVID can impact families, impact relationships. So this is what I'm getting ready to read very quickly. It's an article from the New York Times, and it is the header and within the article says, "Fragile resources overwhelmed." After her husband attacked her with the high chair, Lily limped to the next room and called the police. When they arrived, however, they only documented the attack, then took no further action. Next, she hired a lawyer and filed for divorce, only to find that the epidemic had cut off the avenue of escape too. That avenue of escape. Her divorce proceeding was postponed until April. She is still waiting for the court's decision. And finding a new home amid the outbreak proved difficult, forcing Lily and her daughter to continue to live with their abuser for weeks. It is a pattern playing out around the world. Institutions that are supposed to protect women from domestic violence, many weak and underfunded to begin with, are now straining to respond to the increased demand. And so, as I mentioned earlier, also with the looking at youth development, looking at other vulnerable populations, individuals who experience homelessness, the context of how do we identify resources that can help someone be in a good mental and physical state and remove those type of stressors, barriers, and incidents of violence is important. And if you look at Baltimore City, just as a snapshot, we know we have some communities where there's high incidence and prevalence of violence. So then if we overlay COVID with that, what does that picture start to look like, right? But I think the good news is that there are organizations that have identified the need and started to develop materials to be able to provide free of charge to the public, to give more insight and information to educate and inform. So I've seen public, private, community-based agencies on their websites and their literature provide information to let residents know where resources are, be it at elementary school to be able to get food, be it at a medical center to provide mental health counseling. But also there are regular things that we may explore on a daily basis. I was very happy when, you know, I've subscribed to the Afro-American newspaper, and many of their stories and information provides insight in terms of COVID and how our community sees the issue. And the last thing I do want to say in terms of resources is that there are some entities and organizations locally and nationally that we should be aware of. One of those is United Way of Central Maryland. They have a 211 line where you can get on the internet or call them, and they will help facilitate you and guide individuals in need to the respective services in their community. Residents need support with energy assistance, with employment, with mental health. All of these areas are important, and we know depression and suicide ideations can also come into play when someone feels as though the future looks bleak and they're not sure where things are going to be going. The Black Mental Health Alliance, National Domestic Violence Hotline, National Resource Center on Domestic Violence, National Alliance on Mental Illness. They're just several organizations that have taken an informed, specific focus in developing and sharing information that I believe is helpful not only to the African-American community, but the broader society in general.
Thank you, Dr. Rice. You actually brought up something that makes me think of our seniors. We had a question also from the audience. What can we do to protect our seniors who are, in a vulnerable state? If they're in a nursing home, they're probably being asked to shelter in place and do very little wandering around the facility. But our loved ones, our mothers, grandmothers, what can we do to help them during this time, this crisis? Dr. Fletcher, do you have any thoughts on that?
I think the biggest thing is to follow the guidelines that have been placed out there to assist them and keep them isolated as much as possible, especially if they have compromising medical conditions. They still probably need a little bit of exercise, but if somebody can go to the store for them, that would be better than them going themselves. If they have anything that they need, that someone is able to do that. That includes if it's the cooking, if it's the cleaning. But I think that the major thing is that the isolation aspect is important, and it's challenging, as Dr. Rice was talking about, how that isolation can be very mentally devastating. And so checking on them, giving them a phone call, things that really we may have been doing routinely anyway. But there's no reason not to do it simply because we all are in the midst of the virus at this time. So reach out and ask them if there is something that they need, if there is assistance, and help them navigate the resources that Dr. Rice brought to bear in case they have those, and mostly just make sure that we're careful and handling them, that when we go in, we're still wearing a mask, because one of the things we really haven't talked about is the asymptomatic carrier who has no symptoms, but as Dr. Drummond said, the incubation period is up to 24 days, and you can be walking around shedding the virus, causing harm. And you do need to understand what it takes to keep someplace clean. That we don't necessarily have all of the specific Lysol and Clorox wipes and so forth, but interesting enough, soap and water works very well. We can do that and use that to clean things up. It doesn't have to be what you see. 99.9% of bacteria are killed by this. Soap and water has lasted for centuries. And sometimes the simpleness of it all and touching those chemicals can be devastating over time. And we may be in a period that prolonged contact with these types of disinfectants may have some adverse effects physically on us. So when we talk about washing your hands, they're not talking about washing your hands with Lysol. They're saying soap and water. So sometimes the simple basics, we don't necessarily have to overthink everything. And the latest greatest is good, but if you don't have it, they talk about, I'd hate to tell you to go out there and get some white lightning and mix it with aloe vera to give you some hand sanitizer, but those kinds of things, most people would probably drink it anyway, but
Right.
Thinking that they're disinfecting their inside. But we have to look at these things and sometimes not overthink it and use some common sense. And guess what? Some of those older folks know about these things already.
Mm-hmm.
So sometimes it may be a good idea to listen to them and the things that they talk about. So common
That's a good
sense
point.
sometimes.
Dr. Drummond, do you have anything? Or
I just wanted to piggyback off of Dr. Fletcher and just emphasize, and I think Dr. Rice can probably relate to this statement also. We calling it social distancing, but we actually should be calling it physical distancing, because we actually don't want a social distance, right? We actually want to talk to people. We want to communicate with them. So socially, you can still call someone, as Dr. Fletcher was saying. You can call them more often. You know why? Because you're sitting at home and you ain't got nothing else to do anyway, all right? So call someone, talk to people, reach out to your aunt, reach out to that cousin that you haven't spoken to in a year, because honestly, some individuals are not going to make it through this. And you don't want to be that individual to say, man, I wish I would have just reached out to Auntie Gladys, and Auntie Gladys could be gone next year, you know? So the biggest thing that we can do to help our more at-risk, our more vulnerable elderly population, if we can't go visit them, which is not recommended, and many of them are up there in nursing homes or closed off anyway, as Dr. Fletcher mentioned, pick up the phone, call them, just talk to them. Even if they have Alzheimer's, you can talk to them and you can have the same conversation every day. It's still helpful to them. It's still helpful for them to get through their day. And they may do it every day over and over. Those are little things that doesn't cost any money that I think can go a very, very long way. We don't necessarily need to social distance. I don't like that term. We need to physically distance, but socially, it's okay to be social people and to continue. And I think that's going to help us in the mental aspect of things also, so that we don't feel like we're just trapped and closed in our homes all the time.
Dr. Rice.
Yeah, I was going to say, and again, I think Dr. Drummond makes a very good point. And in terms of us, you know, even as fraternity members, as community members, and other groups that are, of course, reflective of this live stream in this town hall, it's important for us all to build in the time to have an attentive ear to others, not just the attentive ear to others, but also for ourselves. I think that we can be helpful to seniors, to our children, to our partners by being available. But also I think it's important to ask questions and not assume, you know, to ask questions in terms of how are you doing today, brother? How you doing today, mom? How you doing today, daughter? Those things I think are important because the outward appearance may seem as though everything is fine, but in some instances, when you have these discussions or you ask how someone's doing, you may be surprised to find out they may demonstrate, be it through their body language, or even tell you directly that I'm not doing that good. It's also important to check on our own temperature because many of us are helping people, but the question goes, who helps the helpers, right? Do we get our support and strength from? And so while we are all in our own way leaders within our communities or supportive of our families, you know, you hear that that example where you're in an airplane and they tell you that if something happens, you have to put the mask on yourself first before you do anything else for anyone else on that plane. And so I think that it's important for us to be attentive, to be self-aware, to create pathways for support so that dialogues and conversations can happen. Because, you know, we hear this all the time, well, I'm gonna be all right, I'm fine, we'll get through it. But the stigma that's attached sometimes to asking for help can serve as a barrier to people getting support that they need. And so in order to reduce the stigma, we have to be proactive and reach out, but we also have to take the lead ourselves and model what we're trying to do. The last point I'll make here is that as an instructor, I've always been, again, relational with my students. And so when I begin my classes, I will say, before we jump into any of the business, how are you doing? And we may do a round robin where students have the opportunity to say, hey, Dr. Rice, this is how I'm feeling today. This is what's going on in my world. And I found that to be important pre-COVID, but it's even more important now because there are students, there are residents in our communities that are dealing with high levels of stress and anxiety, and giving them a space to be able to share, a safe space, can be very therapeutic and very helpful.
Good points, Dr. Rice. Thank you.
Let me weigh in on that real quick. I had a conversation with one of my colleagues today. He gave me a call because you know, dental offices in the state of Maryland were reopened last Thursday, and he was asking me about some of the aspects of what it's going to take, and it's going to be significantly more difficult to open dental offices now because, as you obviously know, we work very closely with our patients, 6 inches, foot and a half, and the aspect of physical distancing is completely contraindicated from the standpoint I can't get the work done. So we were talking about fitting masks, and he was talking about one of our frat brothers, as a matter of fact, who had been infected by the virus and was hospitalized for 17 days, and he was released and quarantined. And turns out that he turned for the worse, and he called up my colleague and asked him, where can I get a gun? And my colleague said to him, well, did somebody try to break into your home? And he said, yeah. He said, well, really a shotgun is very effective in protecting your property. And he said, nah, I want a pistol. And so my colleagues, knowing what he was going through and those challenges, psychological challenges as well as the physical, I said, well, we're not going to go down that path. We're not going to go down that path. And then my colleague called up a member of the clergy who reached out to our frat brother and spoke to him and ended up referring him for psychiatric assistance. So it pays to be attentive when you find someone who you know well and their behavior is not the usual. We heard about the young lady who was soon to be going to college, I believe, who committed suicide because she was not able to cope with not being able to go out and socialize and things. So pay attention to those who are close to you for unusual behavior. If they make a comment that raises the hair on the back of your neck, take it seriously. Take it seriously. Do what you can to assist them. Refer them somewhere. There are the phone lines that Dr. Rice has presented. But sit them down or get them on the phone and talk to them. Feel them out and try to help them, because when you get devastated psychologically and psychiatrically, you need that help, and you can be the difference in saving a life. But you have to pay attention, and you have to be observant, and it pays even for your own self, that if you feel like you are not feeling just right, speak to someone. I'm certainly, Dr. Rice, Dr. Drummond, myself, certainly are resources for you, for everyone who's on this call. I can assure you that we will do all that we can to assist you in any way that you need it. So I just wanted to bring that to bear, that you don't necessarily know how close you can be to a critical situation that doesn't look critical, but in fact is, only if you pay attention.
Good points, Dr. Fletcher. Thank you. Brother Pomar, do you want to weigh in with anything? Any other questions of the panelists before we take questions from the viewers?
No, let's move on to taking questions from the viewers. I'm excited to hear about their perspectives.
Okay, well, please suggest questions. How is COVID-19 affecting you? How are you coping being quarantined, and how's it affecting your loved ones? Please share any thoughts, any ideas, any coping mechanisms that you may have. Or if anyone has a question about anything else.
I was just going to add, one of the beauties of the town hall is that it's a collective dialogue, right? And so as we have kind of shared some of our insight based on our personal, professional, academic experiences and training, it's great when there's an opportunity for us to have a conversation with the community. And so I'm excited about the opportunity to hear how people are dealing with COVID.
Jordan, I'll share a little story.
So I don't really have a question, but I do have an observation and something that I've thought about personally. You know, I have a friend in Georgia, in Atlanta, and you know, of course they opened, I believe a week or two ago, the governor reopened the state. But something that I think is going to be really pertinent and concerning for people of color is having to like having to be forced back into the workspace, you know, despite reservations of, you know, of the environment being safe. So one of the things that I think that a lot of people are going to have to grapple with is, you know, well, you know, the state has reopened, and so now I'm kind of expected to go back to work. But, you know, I kind of don't want to go back to work because, you know, it's, you know, so it's, I think that's something that a lot of people that's a big decision a lot of people are going to have to make. And it's one of those things where it's a critical decision because, you know, if you have someone elderly in your home but you're the breadwinner, then, you know, you might have to go to work and then you might have to take those adverse steps of, you know, self-quarantining within your own home. Or, you know, maybe you don't even have the space to self-quarantine in your own home. I think that's one thing that a lot of our people, you know, a lot of African Americans are going to have to experience as more states reopen.
Very good points, Brother Hayes. And plus, you know, African Americans, there's a lower percentage of us who have jobs that will allow us to work from home than other people in society. So, you know, you're right. More of us will probably face that decision on going to work or staying home and staying safe. So, does anyone make a comment? Go ahead, Brother.
I was just going to add, based on what Brother Hayes has stated, was some of the first stories that I saw related to COVID, besides the impact on health. The second series of stories were, and some of the incidents in the nursing environment, but were people who were on video saying, I'm quitting my job.
Yeah, so
they're trying to get me to work on a unit, but I have a pre-existing condition, or they know I have several children and I'm a single parent. And if something happens to me, there's no other guardian for my children. I don't have the support here. And so I have seen that, and we've even seen it in different types of work environments where individuals have been terminated because they spoke out and stood up and said that they were concerned about the practices in their environment in terms of safety and health protocol. And so you make some very insightful points.
Brother Jordan, did you
Yes. To kind of piggyback on what Brother Dr. Fletcher mentioned, a real life situation about a month ago. My brother lost his wife. He lives in New York. He lives in the Bronx, New York. And he lost his wife. It wasn't necessarily from COVID because she had dementia, but he was put in a situation where he had to call 911. And of course, they picked her up and he couldn't go with her. Well, he called on a Friday. That Saturday, she passed. And so he wasn't doing well, of course, with the situation. And not talking with him, he started talking like he was suicidal. And so I called my brother here in Baltimore and I shared with him, and we got on a joint call with him. And my brother kind of shared the same thought. It's like, you know, this doesn't sound right. So when we got off the call with him, we were kind of wondering what to do. Well, what we decided to do was to call 911 here. Actually, we called 311 here and talk to them about the situation in New York. They connected us with 911 in New York. 911 in New York had someone go directly to the house and talk with him. And about that, because again, he was saying things like he didn't want to be here anymore. And, you know, he was crying and saying, you know, that he made a mistake by sending her to the hospital, all the kind of the signs that, you know, this could be kind of dangerous. And so they did go to him and talk to him. One of the things that I want to stress is that your relatives or your friends or whoever you may intervene with may get angry with you. My brother called me back afterwards and said, you know, he was kind of, I could tell he was a little upset because he said, you actually sent someone to my house thinking I was going to commit suicide? And I told him, yes, I did. Because again, his conversation, you know, he said, I would never do that. I said, that's not what your conversation said to me. And I said, at that point, I want to make sure that I did everything I could to save his life. He's doing a lot better now. But had I not intervened, one of the statements he made that really got me was that he said, I probably won't be here tomorrow. So that's a clear indication that something is wrong. So even though he may have been a little upset with me for making that call, he's over it now. And I tell you, I'm so glad I made, and we did what we could. My brother and I did what we could to try to do that. So I say, you know, this is real life. You know, if you have to intervene, intervene. Don't just sit back and say, they probably won't do it, or they're just talking. No, this is real life. And so I just want to share that.
Thank you for sharing. Good points. Dr. Rice, you want to comment on coping? You know, people in situations like that. I mean,
Yeah, I was just going to, and first I appreciate Brother Jordan sharing that. I think that, you know, we in the human services field or child welfare, there's, you know, this thing when we talk about meaningful referrals, right? And the reason I mentioned that is that, you know, some of us, you know, we have the ability, of course, to be to activate as a bystander, someone who can get involved, even though we may not have all the information or insight, but we see a need and we're able to intervene in that capacity. But then there may be others who are shy and say, well, I can't see me doing what Brother Jordan did, or I'm not as outspoken, or I'm not as direct. And so it's important to kind of understand who you are and still tap into those resources. So it's not necessarily expected that each of us will be a therapist, but if you speak to the Black Mental Health Alliance, or you call the National Domestic Violence Hotline, they can assist you in thinking through how to support yourself if you are indeed that individual, and also what's the best approach to take in reaching out and supporting someone who may need support. Because what we do want to be a part of is encouraging and being supportive and providing support, but we don't want to come into a situation, be uninformed and make it worse. And that's a lot of our fear, right? We see something, but I don't want to make it worse, so maybe I won't do anything, and that way I won't have to take the ownership if it doesn't turn out in a positive light. And I'll just say to those listeners that there are individuals who this is their different areas. I don't care if it's homeless services, domestic violence, food and nutrition, medical sciences and health, dentistry. There are people that are willing to share their expertise or help make connections for you, so you don't have to do the total lift. You know, it's important that we don't burn out and that we also tap into people who may have expertise that we don't. So clearly, I'm not an epidemiologist, but I know brothers who are, and I know brothers who are physicians who I can tap into and get their guidance and insight and make that meaningful connection for myself or for others. So just know that you have power, and power may not be always direct, but it could be indirect in a way that's still beneficial.
thank you, Brother Rice.
I just want to mention real quick that, to Brother Jordan's point, I have never heard someone regret that they reached out and potentially saved someone's life, and they regretted that someone got mad at them. I always heard that they didn't reach out and they regretted that they didn't reach out. So I think that when it comes to which side of the coin would I go with, I would venture to reach out rather than sit back and say, oh no, I didn't do anything, and later regret it.
And
You're
I,
right. Go ahead, Brother Rice.
no, I was just going to say that, people deal with stress in a lot of different ways. I'm responding to one of the comments. I have a good friend, Mr. James Smith, and he takes walks, right? Long walks that help him in the morning. And he also meditates. And this again goes back to the health, wellness, and mindfulness. So we all have to kind of tap into those things that bring us joy, bring us motivation. So for some of us, it may be reading a good book. Some of us, it may be watching a show. And for others, it may just be talking to a dear family member. But it's important for you to be intentional in considering what are those things that bring me joy and peace, and to also consider how am I feeling throughout the day at different times. Many of us have transitioned to online, who are able to work online, but even that has an impact. And some of us aren't able to do that, and that has an impact. So dealing with stress, we all don't deal with it the same way. And we can't say because I'm doing okay, well, it doesn't bother me, so you should be okay too. And we're both experiencing the same thing. That may not be the case. We all process things differently. Our levels of resilience vary. And so we have to be understanding and mindful of that.
Thank you. One question, Dr. Drummond. Can you speak on the role of vitamin D, how that helps protect us? Do you have any information on that? We got a question from the audience.
I mean, in general, vitamin D is going to be healthy for your skin and for your bones. But in terms of COVID, the only vitamin that has been shown to have some promise, and that there is actually one NIH randomized clinical trial on right now, is high dose IV vitamin C. And so vitamin C is actually the one vitamin right now from just from an actual trial standpoint that's actually being studied right now, and is actually showing some promise. But again, we're talking about doses that are much, much, much higher than the recommended daily dose. So my advice always is to wait until all of the studies are out, because we never just believe one study. We need to see that other studies can reproduce the data from a study. We saw that how that went, how that did not go so well for hydroxychloroquine. So my suggestion is, again, let's wait for all of the studies to come out. Right now, we're specifically talking about COVID. It will be vitamin C, IV vitamin C, and that trial is ongoing right now.
Okay. Brothers, I have a question. All right, doctors, could you please speak to how the COVID virus affects your immune system, and how it affects how it attacks the inflammation in your body? Is it a myth that being able to boost your immune system is going to actually help or hinder or have no effect whatsoever in just fighting off viruses in general? And then also as it relates to the COVID and what it does specifically to the immune system and the inflammation that's in people's bodies.
I'll briefly touch on that. I talked about this a little bit earlier, but so first, in terms of let's talk about what the virus is doing. Again, the body, any foreign invader is triggering what we call an inflammatory response. That's how the body cures it, okay, or treats it. Okay, that's how the body clears an invading pathogen. This virus is doing the same thing. It's just causing a very weird response. When I say weird, it's not consistent at all in terms of how it's presenting to individuals and the type of response that it's mounting. Now that's important because there's a difference between, I guess you would say, a strong, robust, and heavy immune response versus a healthy immune response, right? That's the difference in what's happening with this virus. And we just don't know who is going to have what type of response. So you say, what are some of the things that we want to do? We want to have a healthy immune system, okay? So yes, there are things we mentioned earlier, zinc, ginger, turmeric. There are things that you can do, you can ingest that will help to boost the body's natural immune response. But what you have to understand is that this is an orchestra. There are different parts of the immune response that cause inflammation, and then there are different parts that are anti-inflammation, right? And so I don't want to get into the specifics of which ones those are, but the big thing is it's an orchestra. It's a balance that's being maintained, pro-inflammatory and then anti-inflammatory. And this is what is happening in a healthy immune response. So you can imagine what happens in a immune response that's pro-inflammatory here, anti-inflammatory down here. That's going to cause a hyperactive immune response. That's what we see in patients that have autoimmune disorders. They have a hyperactive immune response to something. Individuals with allergy, right? Individuals with asthma, individuals, these are hyperactive immune responses that are occurring in the body, or inflammatory responses, you would say. Now, the opposite of that is hyperactive anti-inflammatory, not enough pro-inflammatory, right? So now we're on the opposite end. That can also be bad, right? So if you have too much of an anti-inflammatory response and not enough of a pro-inflammatory response, that's not a balance either. So the long and the short of it is we want a healthy immune system. The way to boost the healthy immune system, you can do some of those natural things that I mentioned. I tell everyone, I don't care if you're a kid. I have 2 kids. One is 7, one is 12. They both take a multivitamin every day. They make them in gummy forms now, so it doesn't have to be the annoying pills, right? Every person needs to take a multivitamin every single day. They have zinc or Centrum for women, Centrum for men. Don't care which one they are. Those are things that are helping to build a healthy immune system. And then again, I've already mentioned some of the natural things like turmeric and zinc and ginger. Those are things that are going to build a healthy immune system. But what's happening with this virus is it's just causing, in some individuals, a complete overrun and over an inflammatory condition, which you'll hear that term cytokine storm. That's what's happening. It's basically just causing this robust response. And so that was why initially they thought hydroxychloroquine might be good. It works in lupus because lupus patients have a hyperactive immune system towards one thing. So the medicine hydroxychloroquine is basically acting to dial back the immune system a little bit, dial back that inflammatory response, because again, we want a balance. We don't just want it to be overactive.
Thank you, Dr. Joe. I want to welcome to the call Brother Cleve Ewell, who's the Eastern Province Keeper of Records, and he's also a psychiatrist. So welcome to the call, Brother Ewell. One comment that we had was that a brother in his workplace recommended that, or tries to help his employees by giving them extra PPEs, extra protective equipment for when they're working on the job, but then also after they leave. And that helps to protect everyone or more people. So anyone want to comment on that? Any of our panelists on the?
Well, I think it's always an issue of resources, and oftentimes we may look at a situation. Maybe we're looking at the news, and we see a lot of people running around without a mask. Or we go to the grocery store, or we're driving down the street, and we see people who don't have a mask on, and some of us might say, "I can't believe they don't have a mask on." But the fact is that the resources trying to get that PPE these days can be tenuous. Not only costly, but the average person probably has no idea where to look for it. And the common places that they would look for it is sold out. I can tell you I went out to Sam's Club and was looking for Clorox wipes. They weren't there. So what do? I just don't have them. They don't sell masks. If I go to the drugstore, you walk in, the shelves are bare. Well, what do? That's where we came up with the cloth mask that people are making and so forth and so on. And so to the degree, again, that me and my colleague were having this discussion about opening up his dental office, they're going to be looking like they're in a hazmat situation, cleaning up, hazardous material. They're going to be covered head to toe, face shield, just to treat a patient. things are different. When I started dental school, that was the beginning of wearing latex gloves and masks for dental school in 1983. HIV became very prominent. Unfortunately, a selfish dentist injected some of his patients with his HIV, and they died. And I had another conversation with a colleague earlier today who said, you know, what is it about that they scrutinize dental offices so much? Well, you know, a dental office is actually cleaner than most hospitals. Dentists disinfect every day after every patient, and at the end of the day, they wash their hands more in a day than you do in a week. They generally are wearing protective equipment every day when they see their patients, but now it's going to be even worse. And the cost of doing business and the cost of protecting themselves, protecting their staff, as Ricky was talking about, and protecting their patients. And you know, you hopefully are screening an asymptomatic, non-shedding patient who doesn't have a temperature. They don't know if they are infected or not. They probably think they aren't. That's why they're out coming to see the dentist. So the personal protective equipment issue is one that you know, we have to look at from an access. We talked about food deserts, and we talk about other aspects where there are resources to some communities and there are not that resource to others. So you know, I kind of temper my thoughts in those situations. And actually, I've placed an order for PPE about 3 weeks ago. I haven't gotten it yet. And we're talking about the N95s, the hazmat suit, and all of that. I don't treat patients anymore, but you never know. I might just need it. And sometimes it's better to have than have not. But for those who don't have that resource, you know, it can be a challenge. And there's not much to do. But again, we talk about the soap and water and washing your hands. And quite frankly, it doesn't hurt to wash your face too. You can use that same soap and water to wash your face. You know, you talk about don't touch your face, but if you did, hey, wash it. It's not that big of a deal. You can do that every day. You should do it several times a day, you know, and again, common sense and the opportunities and resources are there for some, not for others. So it's very nice that Rick's in that position to expend his someone else's resources, I'll say, to help other people. So that's just something to consider.
Thank you, Brother Fletcher. Dr. Drummond, we had a question about diabetes and hypertension. Why someone with those conditions, why are they at greater risk or vulnerability to COVID-19?
That's actually a really good question. I actually have there's a really good review that's out right now that looks at kind of the inflammatory response that's happening in each organ system, right? And so hypertension is primarily a problem with the vasculature, okay? And it could be the vasculature in the kidneys, but has this problem with the vasculature and regulation, okay, of the blood pressure. And then obviously heart disease is going to be, or cardiovascular disease is a problem with the heart, but the way that the virus is actually causing these inflammatory responses in these various organ systems is actually, you know, that's something that's still ongoing, it's still being studied. The best that we can gather is that the healthier you are in general, then the less likely you're going to be negatively affected. But that's just one part of it, you know. As I mentioned earlier, this virus is not really following any of the rules that it's supposed to in regards to how it's affecting individuals. We expect that individuals with asthma, with COPD, which is chronic obstructive pulmonary disease, should be affected negatively. Even individuals who suffer from obesity, right? So some of these actually tie hand in hand with obesity, all right? And there are going to be a number of papers that are going to come out where we're looking at obesity. Individuals with obesity, sometimes at baseline, have something called obesity hypoventilation syndrome. So because these are actually associated with obesity, and these individuals, and what we mean by that is sometimes can't even take a deep breath sometimes. So imagine an inflammatory condition that's bothering the lungs that's now not allowing them to take deeper breaths, right? These are all some of the things that we're seeing. But to be honest, we just don't have all of the answers yet. But we do know that this inflammatory cascade, it's affecting every single organ and every organ system. And some of the reviews do a really good job of showing what's actually happening with the kidneys, with the liver, with the heart, and with the vasculature. Another one last part is that what we seem to be seeing is that this inflammatory cascade is somehow also affecting the coagulation of blood. And so we're seeing an increase, a hypercoagulable state and clot formation in patients that are having COVID that, again, is a little more complicated probably to explain right now, but that's something that we think there's an interplay there also. So, there's no steadfast healthy individuals can't get COVID. That's not true. We do have people that are completely healthy that have died. We have people that are completely healthy that have been hospitalized. But yes, for the most part, individuals that have no comorbidities, no diabetes, high blood pressure, not on medications, for the most part, they have a healthier immune system and are likely having some type of protective advantage. Doesn't mean that they can't get sick. And then on the opposite end, the more comorbidities that you have, that just means that at baseline, your body's living in a less healthy state. Then you add this new pathogen, the body now has to deal with this weird inflammatory condition. It's kind of like all bets are off. And then we end up with some of these adverse events that we're seeing in these patient populations.
I'm going to add to that inflammation is a chronic issue with probably 80% of adults in the world. Many people don't think about it, but if you have gum disease, your gums are bleeding, your gums are inflamed. And there's a protein within your system that responds to this inflammation and is what relates to heart disease, kidney problems, diabetes, lung problems. And inflammation in a general term is present in many, many adults simply because of bad oral health. So you can be healthy, have a bad oral health in your oral cavity, and carry this inflammation. And if this virus is responding and taking advantage of inflammation and exacerbating it, if your mouth is not clean, you could be vulnerable. Being healthy in all other aspects, no hypertension, no diabetes, not obese, but you have inflammation. So it's very important to keep in mind, a shameless pitch, you go see your dentist twice a year. Make sure your teeth are clean, your gums are clean. But this inflammation aspect that Dr. Drummond is talking about can affect anyone. And you have no idea that the inflammation is really the root cause of where you're going with it. But then you start throwing on the damage that the inflammation has done to the organs, as he said, and the cascade develops from there. So, person looks fine to you, six-pack abs, well-defined, they all cut up, and their teeth are falling out. That person is susceptible.
I have a question for Brother Fletcher. Brother, since we can't get to the dentist, like you said, is there anything extra we can do to prevent the inflammation to make sure we do keep up with that good oral hygiene?
Well, the only thing that I would say to you is generally what I would say to my patients. You see me twice a year, but you have to take care of it every day when you're not seeing me. And I'm seeing you twice a year to make sure that nothing is going bad and trying to be preventive. But if you follow good oral hygiene practices every day, and we do the 2 for 2, brush twice a day, 2 minutes each time. 2 for 2, twice a day, 2 minutes each time. If you do that, you can use any toothpaste you want. It should have some fluoride in it. But if you do that, make sure that you brush, you floss as well, get the food out from in between your teeth. You should do that. And that's the basic is, you know, when you wash your face, you take a shower, brush your teeth. Before you go to bed, brush your teeth again for 2 minutes. That's really the best that you can do for yourself. And you should be doing that 363 days out of the year, because the other 2 days you've come to see me.
Any other questions? Well, Brother Polmark, I want to come over to you and get the charge as we leave tonight. Want to wrap up?
Oh, thank you. So 100 years ago, the African-American community found itself in just this situation. But there were a couple exceptions. One, it was the Spanish flu, and the other, we had the specter of Jim Crow. Right now, there's definitely income inequality, there are health disparities, but now all those things are happening to us within the context of COVID. The charge I have for everyone who's here with us in Zoom and here with us in Facebook is to take the information you've heard today, use it to keep yourself protected, to protect your family and your friends, to dispel any conspiracy theories, and then come back to us. We're going to delve into spirituality, and because now it's about helping us stay healthy, helping us thrive. And then we're going to focus on how we can sustain the economic impact of COVID-19. I want to thank each of you for joining us today, whether you're on Zoom or on Facebook. And we look forward to you being a part of our future town halls and the future efforts that are sponsored by the Social and Political Action Committee of the Baltimore Alumni Chapter of Kappa Alpha Psi. Thank you and have a beautiful evening.
I also want to thank our panelists, Dr. Fletcher, Dr. Rice, Dr. Drummond, and we ask that you, the one takeaway I had from earlier, assume that you and your loved ones, the ones around you, have COVID-19 and act accordingly. So please be safe. Have a good night, everyone.
Thank you.
Thank you. Good
God
night,
bless.
everyone.
Good night, everyone.
Good night.
Yo.
Yeah.
Good job.